Welcome to Mid-American Money. I'm Ernie Goss, Professor of Economics at Creighton University and Director of the Economic Forecasting Group, also at Creighton University. Today, I'm joined by Tony Hendrickson, Dean of the College of Business, and also we have Deb Bass today joining us, CEO of Bass & Associates and the Interim Director of the Nebraska's Health Information Exchange. And of course, today we're going to be talking about those very issues, health and the economy. But first, let me review our survey findings from the our August survey of supply managers in 9 states, stretching from North Dakota and Minnesota to Arkansas and Oklahoma in the South. And I'm sorry to say the index, the survey, was not a good survey, but the economy is trending ever so slightly. We're crawling out of this economic hole we've been in, although, again, the August numbers were not that good. And we were surveying 1,000 businesses. So first, the business condition index declines for the first time since January. Of course, again, the index is between 0 and 100. 50 is growth neutral. It moved below growth neutral. The inflation gauge rose, and it's indicating we've got inflation in the pipeline. Now, this is at the wholesale level, so we haven't seen it at the retail level yet, but I think we're going to see some of that in the middle of 2010, as early as 2010 middle. Only 9% of the firms that we survey report positive impacts from the 2009 stimulus package. Now, that's not surprising, but certainly not what we'd like to see. And finally, the region lost jobs. In fact, we're losing jobs in the region probably at about now 1.5% pace annualized. So, with those things, that said, Deb, now you're a CEO of a company that's been doing staffing, I think, for 18 years, I believe you said, in the Nebraska, the region, the nation. You staff across the nation. What does the economy look like from your vantage point?
Well, it's very interesting, Ernie. We're seeing mixed results, just as your survey indicated. We see some segments that are very strong, such as healthcare now.
Healthcare, and that's what you're really doing a lot of with the Health Information Exchange, you being the interim director there.
Exactly. Governmental needs are continuing to grow, and so that's what we're seeing from the surveys from the other areas, is that those two segments are the most in demand right now.
So that's where you're seeing a lot of opportunities there.
Exactly.
Okay, and where is it slow? Where are you seeing some slowdowns from what you saw previously? Or are you seeing any slowdowns in any of your areas?
Pretty much in all the other segments.
Oh, everything except
retail,
healthcare?
manufacturing, transportation, financial. It's pretty much, let's just make certain that we really have a need to hire another permanent employee versus just kind of keeping the status quo. And what's interesting is that we're seeing more stress in the workplace because of that.
You mean individuals are under stress? They may be fired, there may be their hours might be shortened and so on. So they're feeling the pinch as the companies are feeling the pinch. And Tony, what are you seeing? I mean, in your dealings with businesses, and we have, and that said, we have a director of placement who does placement. So it's not like we're divorced from the labor market.
Right. I would echo what Deb sees. I think that there's certainly some softness in the market. There's some concern that I have right now is what the survey numbers report here for this region. Is this a trend that we're having some type of double dip recession? Are we the precursor of something worse to come, or are we just kind of a laggard and following the rest of the economy ever so slowly? We've had a very robust economy here in the Midwest relative to the national economy, and are we just now catching up, or are we actually leading a little bit and a precursor of something of a
Or
worse?
is it maybe the farm sector? And the farm sector, of course, is very important here, and farm income's down by 25%, but we'll talk about that a little bit later. Deb, from your vantage, and Tony, you as well, these programs, and you and I are Dr. No's, I think. We just say no. Everybody says, well, the Republicans and conservatives are just a no, the party of no. Well, you and I are the The nose.
Yes.
Now, we're not. I'm not registered. I'm a registered independent. So that's said. But
Likewise.
Okay, so I'll try to be nonpartisan. But Debbie, which of the programs are you seeing any impacts from? Because we surveyed. Our survey, they're saying none of these programs are really hitting them. Now, maybe we're just surveying some very unusual companies. Are you seeing any of these programs, these vast array of cash for clunkers, cash for appliances, cash for economists? I mean, that's what we mean.
No, we're really not seeing a great deal of impact yet. But keep in mind, again, the two segments that we've been working in, the healthcare and government, that stimulus funding, they just released their first RFP on August 20th, and they're projecting the funds to start flowing January 2010. So I'm not surprised.
And you're doing business. I mean, you've got business across the nation. I
Yes,
mean,
we do.
You're in what states? Several. You're of course in Kansas, I understand. And
Missouri, particularly in the healthcare sector,
yeah.
North Dakota, South Dakota, Missouri, Kansas, Nevada, and we're talking with other states as
Maryland, I think I understood you.
Yes.
Yeah, so this is we had under George Bush, we had no child left behind. Well, now we may have no economists left behind, because this has been a wonderful time for economists. I mean, I don't have enough time to sleep. We're so busy. But what's good for economists may not be good for the rest of the economy. Now, you're in healthcare. I would argue maybe spending more on healthcare is not a bad signal. This is an odd way. Think about this. That we talk about healthcare, it's just such a problem. We're spending so much, and we turn to education and say, well, look how much Mississippi's not spending. They need to spend more. In other words, is spending a lot good, or is it bad? I mean, for you, it's just not so bad. I mean, in healthcare.
Well, there definitely are indications, and no one is going to argue that interoperability is going to dramatically improve patient care, patient safety. The issue is that there's this sense of urgency to spend money and to make it happen. The phrase shovel ready versus planning.
Shovel ready, I like that one.
Exactly. So we're all trying to do the best that we can to appear that we're shovel ready versus just planning. So sometimes decisions are made rather hastily.
And you were in healthcare in
Right.
in the delivering
I was a registered
healthcare
nurse, yes.
in another life.
Right.
Well, not that you're in. Well, I don't even want to
Now we're getting into
dig
religion.
into that. No, let's go. Turning to my youngster partner here, being the oldest person, I think, within this side of north of Omaha. I better not. Don't even want to go there. I'm definitely in the other half. Tony, what are you seeing in terms of?
Ernie, you brought up an interesting point. You brought up about what we spend, especially on education. There's a wealth of studies that show that there's very little correlation to better quality education and spending. In fact, the city of Detroit has one of the highest rates of spending on public education, and some of the poorest results from that. So there's not a direct correlation always between quality and the dollars we spend.
But where do you think?
And I'm not sure that the same holds true for healthcare or not.
But which programs, this vast array of programs, which ones do you think? Give me the best one of them that you think. What has the federal government done that's good or modestly good or not so bad? Which one of them?
Well, I'm at a loss.
Okay. Give me the worst one.
I will.
Give me the worst one. I will say,
I'll give you a couple of examples of why I have some concerns.
Okay.
There's a mixed bag between cash for clunkers, for example.
Okay.
In the state of Missouri, it's been very popular, been very well received. Of course, they have a lot of auto manufacturers.
And our
there.
survey's been good in Missouri.
It hasn't helped North Dakota, Nebraska, Iowa, and some of those states in an equal proportion. It has led to the opening of and extended hours in some factories in GM in particular, and some other car manufacturers. Ford, although, has reported a decrease in profits, even though they had a double-digit increase in sales. So it's kind of a two-edged sword. The second thing that a program I would point to has been the TARP funds. We put this federal bailout to save these financial institutions. If you recall, at that time, one of the big issues was the amount of executive compensation that was paid to these senior executives. And the government was going to step in with more regulations and better oversight and fix this problem. And recently, the government's now reporting that those firms that receive TARP funds, large banks, actually have executive compensation some 30-some% higher than those that didn't receive it.
Well, wow,
So
surprise, surprise.
I'm very skeptical about whether or not all the government intervention has worked in the marketplace.
Okay, let's try to be a little more positive. I mean, not to say you're
Sure.
negative now, Tony. You and I are.
I'm very positive about the free open market options of our economy.
Exactly. Deb, the various healthcare reforms, we don't have a actual bill. I mean, HR 3200 is one, but it's vast array. What's some of the good reforms that you see that might actually happen in healthcare?
Well, I'm very excited about the current proposal for health information exchange. The reason that that is so challenging is that there's a diverse group of stakeholders, and we all come to the table with different perspectives on what's good and what's bad for each one of our industries. So it's difficult to bring that diverse group together and help them to agree that we're going to be open with our information and share it, versus the traditional business model where if you owned the information, you pretty much retained your patient base, and that was your guarantee that you would be well in the future. So this is somewhat threatening, as you can imagine. So we're going to now begin to compete on cost effectiveness and standards of care.
Okay. So it's like I remember getting my dental records when I moved cities, and you're like, well, is this my dental my dental record or my poodle's? I mean, you know, well, whose record is this? And then that next dentist gets and says, what the heck is, I can't use this. So you're saying standardize some of these records so that when you move from Minneapolis to Atlanta, that record can go with you, and if you're in Atlanta and you have an accident, that the physician there can get access to those records?
Exactly.
And that's what you're involved with.
That is very much what we're involved in, and it is exciting. It is transformational. You've heard much conversation in recent years about consumer-driven healthcare, and that's where we are going, where you as an individual will be able to access your information just as you do currently with your financial services. And
well, let's turn to Dr. No now, and give us one of the negatives.
Well, you know, I'm going to say something positive.
Oh, you're okay.
I'm going to say something positive.
Then I'll be Dr. No.
The starting point I would say is I think that healthcare reform, we need to address two issues in particular: pre-existing conditions.
Okay.
And I think that's doable through reinsurance. I mean, much like we all insure ourselves now against catastrophic kinds of things. Insurance companies also insure themselves against their own actuarial mistakes by reinsuring, and we can do that through reinsurance and make that possible. So that we're not stuck. So a particular company is not stuck with a person who has a pre-existing condition that would be catastrophic to that insurance company's balance sheet. We can do that. We should do that. That's important.
Okay. What about this one, Tony? Sorry to interrupt there, but we are around a lot of young folks, and much younger than me, of course, at schools. We're going to require most of them. A lot of them don't. Most of them have insurance, but a lot of young folks don't have insurance because they're like, why should I? Why should I pay that? Demanding mandatory insurance for everybody.
Absolutely, and one of
that would subsidize us, of course.
That would, and they are part of the 47 to 50 million people that we're talking about don't currently have health insurance. Now, they're one segment of about a group of about 60% of that 47 to 50 million people who don't have insurance but qualify for either Medicare, Medicaid, haven't signed up, or just opted not to do it, or fall under some other kind of program. Maybe even their employer program and haven't signed up.
Well, which now, talking about the uninsured, whether it's 10 million, 20 million, 30, whatever, we have what we call the law of supply and demand. It's not. We don't say it's a good idea. We call it. We go so far as it's a law. You know, and when you bring 50, 40 million folks more into the system, and the reason we're doing it is so they can have health care.
Right.
Okay. Well, that means prices go up. Prices. Deb, what are we going to do about this? Are we going to ration care? Now you're on the side of more efficiencies, which is good. Now that's where you lower costs. But do you see rationing in our healthcare future, at least what do you see there in terms
That's
of?
why we're working, we have to get to the efficiencies if we're going to be offering this. And that's another issue that I see with the employment statistics, is that we have reached that point where employers can't afford health care and they can't afford to deliver it to their employees. So that's why we're seeing more and more numbers of the underinsured. They're working for the small businesses, which are, by the way, the jet fuel for our economy. So if we start limiting the choices for employers to get the best employees because they can't give them the benefit packages, that's a double whammy to the economy.
Okay. All right.
I think that the question we have to ask ourselves is, can you readily see your physician today? Can you readily call him or her up and get an appointment readily and go see them?
Right off the golf course.
And if that's the
that's not true, by the way. He's a wonderful physician.
and
he watches this program.
I think most people say it's kind of hard to get an appointment. Well, that tells me there may not be the slack in the system that we would hope. Now, if the answer is, well, people can readily see physicians, they can go to emergency rooms and they can be treated, then that begs the question of, well, it looks like people do have access, and so we're chasing after an access problem that doesn't exist. I submit to you that there's not the capacity in the system, and you're right, it's not a guideline, it's a law of supply and demand. If you add additional people and you can't already readily get an appointment, what do you think your options and your opportunities to get an appointment will be when you add additional demand? It's got to lengthen that out. There has to be some type of either line, queuing process, or a rationing process to make the system work.
But Deb's going to give us lower costs, and that's good.
Right.
But how long does that take?
It's a distribution problem, is what it is. It's a distribution problem.
Okay,
it's
so we've got the health care. How do we spread that out, distribute it? What are some other ways of health care savings? In addition to the information sharing that you're heavily involved in, where are some other ways of saving? How can we save in this healthcare environment?
Well, and we are very careful to say that we're looking to control the rising costs.
Yeah, not control it. That's Canadian healthcare, and Tony and I are like, whoa, wait. I'm at the point where I don't know if I want that, But so controlling the growth.
Right, because we have had such, over the last 10 years, the costs have just been jumping so dramatically. So by gaining these efficiencies, we're hoping to get a better understanding. And first of all, by using technology, we can get a better understanding of just what is happening, because there is a great deal of confusion out there as far as the bills that you get from your insurance companies, your doctor's offices. If we can just begin to get a better understanding of how this is all flowing, we're just beginning to understand what we can do to improve.
Yeah, I mean, you've gotten those bills, and it's more difficult than the exams in my classes. I'm like, what is this? I don't understand it. And I'm a modest ability I think, to gauge what is in there, and I can't. Who does? Tony, where have we got some savings? Where are you going to get some savings?
I think the savings have to come with immobilizing private industry and innovation.
Okay,
and I think Deb's right. Part of this is a distribution problem, and if it is a distribution problem, let's look at two competing models: the United States Postal Service as a government-run option, and Federal Express and UPS. Even President Obama has said that Federal Express and UPS are doing very well. It's the postal system that is having difficulties at this point in time. Well, the people who are experts at distribution, in my opinion, are Federal Express, UPS, more so than Postal Service. So maybe we ought to have Federal Express run our healthcare distribution system.
Apologies to all of our viewers from the Postal Service,
well,
because they do. I worked for the post office when I was in college.
I understand that, but my point is, it took private industry to come up with an innovation that would deliver a package anywhere the next day before 10:30, and people said that couldn't be done, and yet now it's part of the fabric of our culture that I'm going to have it tomorrow morning.
Okay, well, now turning to the biggest challenges now, economic challenges, not necessarily in healthcare, but anywhere. What, Tony, what do you see is the biggest challenge in this next few months, or perhaps the year, the next 12 months?
The biggest challenge, I think, is to see sustainable growth, and yet deal with the inflationary aspects of it. I mean,
Okay.
I'm concerned that whether or not we're going to actually see some downturn, especially if we add a lot of additional taxes, that's going to really put the dampers
Okay,
on the
because we
growth.
are looking at higher taxes, higher interest rates,
Right.
and higher inflation.
Right.
Deb, what do you see as an economic challenge that the economy faces? You talked about the small business, the jet fuel of our economy. Where do you see challenges?
I see several challenges. First of all, because there is such a sudden demand for some of the healthcare technology services, and this implementation versus the shovel-ready versus planning, people are standing in line, so prices are beginning to go up for those kinds of
And we don't hear much
technologies.
about that. It's odd. You know, we talk about deflation. What about inflation? You know?
And the real issue is that the problem will be is being able to access all of those kinds of vendors with the services that they need, and we're all scrambling to look for the technology professionals that can help us to implement, which is also part of the Regional Extension Center and working with the universities to develop the curriculums for the HIT professionals, because we seem to have a bit of a gap in the educational system for delivering those kinds
You
of
mean
skills.
we're not delivering the shovel-ready workers that we should? Not necessarily at Creighton, but the overall, we're not shovel-ready in terms of our students. Is that possible? Or-
Well, exactly, because
So no, but maybe community colleges, a little more action there, a little more they're seeing, not to, again, say we're not doing the job, but maybe we just we in education need to do a better job. Well, I think, you know, the challenge that I see is just dealing, as Tony said, the Fed here is interest rates, short-term interest rates, 0 to 0.25%. They're putting fuel, gasoline on the fire. Well, sooner or later that thing puffs up, and we see fire, and we see too much inflation. At the same time, as Tony said, our economy it's not on fire. It's at best sort of crawling out of this economic hole that we've dug ourselves into, beginning in December of 2007, even earlier for some states, later here.
When you have minimal growth in your business, and you see that growth not keeping up with inflation, and your taxes going up, it becomes very discouraging and really challenging.
Well, taxes are going up. There is no one talking about lower taxes. No one, unless it's
you and I.
you. we're
No one's listening.
We're praying for lower taxes and saying what good that would be. At the end of 2010, of course, taxes go up automatically. Right. So with the expiration of the 2001-2003 tax cuts. Now, Tony, let's take an economic headline for the next month. You've been pretty good at these headlines. You've been right on with.
You know, I think that there's definitely going to be a September correction in the stock market.
Well, this is September. Should we just get up from here and go sell?
You're not
proposing. We don't make investment advice.
We don't make investment advice. I will say that I do expect that the fall will be a little rocky.
Okay.
And, that I expect the September correction will in fact come and
that's
and
going to
be
make
pretty
headlines.
solid. Yeah.
Make headlines. Do you have an economic headline from your vantage point, or a healthcare headline? I mean, we're both focused on the economy. Not to say you're not, but what's a headline there?
Well, I'm going to take a positive spin to that.
Oh, well, cool.
And I feel that a headline could be that Nebraska will be leading the nation in the implementation of Health Information Exchange.
Oh, that's
good.
Well, it's already leading
exciting.
and getting headlines for that very issue. The governor, our legislature, your organizations, companies like yours, plus the Nebraska Health Information Exchange.
It's a wonderful opportunity for Nebraska to display the level of healthcare professionals that we have and healthcare systems and providers. We are uniquely blessed and have an opportunity to demonstrate to the rest of the country what this is all about.
Okay, and my headline is FDIC runs out of money. In other words, the group, the organization that insures deposits up to $250,000 in banking institutions runs out of money. Now that's sort of big in terms of confidence. Of course, they go to the Treasury and get a loan. In other words, bailout for FDIC, and that's going, in my judgment, that's going to happen. So, now this next discussion we're going to have, Deb. Now you're on the board at the Federal Reserve, so you're limited in what some of the things you can say. But Tony, what's the Fed going to do in the months ahead?
I think they're going to have to stand pat.
Not do anything.
They can't do much of anything. They can't tighten credit. That will kill the economy. They can't loosen it any more than they're doing. They're already, pouring gasoline on the fire as quickly as possible.
So they're going to sit on the sidelines. Deb, yes. you want to weigh in here, or you just again, you're limited in what you can and can't say about the Fed. So.
I'm going to take a generic stance and say they are very interested in some kind of consistency. They understand fiscal policy, and their frustration lies with the politicians that don't understand fiscal policy, that are doing knee-jerk reaction kinds of things. And so,
okay. Well,
I'll just keep it at that. How's that?
Okay, that's great. I say the Fed is going to pull back some. In other words, they're purchasing mortgage-backed securities to keep interest rates low. I think they're going to have to step back on that, and so we're going to see probably higher interest rates. But the housing market has recovered to some degree, so they're going to step back. And at least in terms of mortgage-backed securities. As Tony said, though, they're going to have to leave interest rates the same.
Ernie, will that be the first step in leading to higher inflation, higher interest rates driven by that decision?
That will be reflective of the higher inflation, yes. It'll be reflective of, not necessarily the cause of, but that's certainly the case, and I think we're going to see that. The Fed's got to, how do you pull back? You don't do it in one day. You don't do it in one meeting. You got to do it one step at a time. That's the first step, in my view. So, okay. Well, thanks so much. We just touched it. We just touched things that seemed like today. Well, thank you for joining us today. I'm very pleased and thank Tony Hendrickson, Dean of the College of Business at Creighton University, for joining us today. Deb Bass, CEO of Bass & Associates, for her insightful comments. And thank you for joining us as well. And until our podcast, our broadcast in October, thank you, and we'll see you then. And in the interim, may your economic cup runneth over. Thank you.